Hi everyone, I'm Dr. Piramzadian from Drip IV Wellness and Med Spa. Things that we're going to discuss. Obviously the biggest thing during the month of January is people want to lose that weight, feel good. So we're going to talk about weight loss medications. We're going to talk a little bit about exercise, dieting, and then the programs that we have at Drip IV Wellness and Med Spa. So obviously everyone's heard of a lot of these different types of weight loss medications. We're going to go over the different types of meds that are out there, the side effects associated with it, people that it works for, the benefits, unfortunately the costs associated with it, and the risks associated with it. At this point, about 70% of Americans are considered either overweight or obese, which is a significant number of the population. This even includes kids at this point. The obesity rate has tripled in the last 60 years. So there's a lot of compounding factors for this. We don't exercise as much, we eat a lot of garbage, a lot of the food that we do have access to are full of fat. So overall it all just compounds together to obviously what we call the obesity epidemic, which means we're just getting bigger. Now, we obviously know that increased weight causes other issues. So being obese leads to high blood pressure, high cholesterol, diabetes, cardiac risk factors, overall just not feeling well, decrease in energy. So there's a lot of different things that happen with us, unfortunately not losing this weight. Now, there are medications out there. Some of these medications have been out there for years. One of the big ones that have been used is something like phentermine. There are newer medications out there. These newer medications are your GLP-1 agonists. So the GLP-1 agonists are your Wegovy, Ozempic, Mounjaro, semaglutide. These are the newer class of medications that were initially made specifically for diabetes. It keeps blood sugars down, but they realize that it works fantastic for weight loss. And then obviously there are other things out there like Topamax. Topamax is a medication that is used to help with weight loss, usually in combination with something like phentermine. So let's talk about these medications. We'll talk about their risk factors, some of the costs associated with it. So the first weight loss medication we'll talk about is one that a lot of people have heard of. It's phentermine. Phentermine is a pill. This is a pill that's taken daily, and it's usually done in 3-month cycles. So you take it for 3 months, and then you have to take a break. Phentermine is one of the older medications. It's one of the cheaper medications now. You can get it from the pharmacy for about $15 to $20 a month. And this medication, what it does is a couple different things. It decreases appetite, it increases metabolism, it can help with energy levels, it can help with mental clarity, because it helps in ways that are very similar to, let's say, ADHD medications. Now, phentermine does have side effects associated with it, like all medications. Most common side effects associated with it, you can get a dry mouth, which is kind of helpful because you drink a lot of water, which we definitely need to help with our weight loss. It can cause, unfortunately, palpitations. It can cause anxiety, increased stress. It can lead to heart arrhythmias because the heart's going faster than it should because of this medication. So when we're looking at someone that's appropriate, and Teresa says trouble going to sleep, because it keeps you active. Unfortunately, these medications, you want to make sure that you're giving it to the right person. So people who have a history of anxiety, this may make your anxiety worse. People with heart arrhythmias, we want to stay away from. We don't want to cause these arrhythmias to be worse. So, and like Teresa said, people who have difficulty going to sleep at night, we want to make sure you take these pills in the morning so it wears off throughout the day so it's not as bad. But it's a very effective medication. again, you can only take it for the 3 months before we give you a mandatory break to get your body weaning off of it. Some people do fantastic with phentermine. Some people can do great for 1 round or 2 rounds and then it stops working. Now, again, medications by themselves are not the only way to lose weight. You still have to do all the right things. By eating appropriately, by exercising, you're going to help increase and augment that weight loss. Other medications out there, Topamax. So Topamax is a medication that's used for migraines, for seizures. It's a safe medication. What Topamax does is when you add it to people who have taken phentermine before, it works with the phentermine to actually increase the effectiveness. So it decreases those cravings, it decreases the sugar cravings, the appetite, and people actually lose more weight with the Topamax combination of the phentermine. Again, a relatively cheap medication. Then we get to the fun ones. These are your Wegovy, your Ozempic, Mounjaro. These are the medications that you're hearing about in the news all the time. You're hearing people are losing a lot of weight with. These medications are your GLP-1 agonists. What that means is it targets the GLP-1 receptors. These medications are very effective in controlling blood sugar. And what they realize is people who are taking these medications for diabetes, which they were originally for, have noted significant other associated benefits, which means they've lost a lot of weight with it. People can lose up to 20% of their body weight by taking these medications. Now, the studies ran for about 1 year to 2 years, so it's possible they can lose even more weight after that. The way these medications are given, it started at a very small amount. And these are injections that you take once weekly. And these small amounts start to increase as the time goes on. And the reason for that is when you take too much of it to start off with, for example, the dose that you need to really lose weight at, it can cause people to have a lot of side effects. So a lot of GI issues, nausea, vomiting, heartburn, constipation, diarrhea, anything you can think of that's GI related, it can cause. Because it's obviously messing with the GI system. Now, by doing the gradual step up, these side effects are decreased. So it's a small dose to start off with for the first month to the first 3 months, and as a result, your body starts to get used to it, and you start stepping up the amounts that you're getting. Now, the 3 medications, the Wegovy, Ozempic, Mounjaro, they're all pretty much the same medication. They all have semaglutide as their main ingredient. They're made from different manufacturers, so it's a little tweaked, obviously, for each one, so they can have their patents. These medications are very effective at decreasing appetite, decreasing cravings, increasing weight loss significantly. So people have lost 40 to 60 to 80 pounds by taking these GLP-1 agonists. Some of the things that are concerning with these, they have been used for years. So we do know about most of the long-term side effects. There is a specific type of thyroid cancer, if you have a family history of it or a personal history of it, that you should not be taking this medication. There is a concern that it might increase that specific type of thyroid cancer. But no other real long-term side effects are associated with these GLP-1s right now. So that's why they're so popular. Now, they've also been shown to help in Alzheimer's and Parkinson's. It's been shown to decrease cardiac risk factors, so heart attacks. Obviously, it controls diabetes. With the weight loss, you're losing all this extra weight that your body's used to. So as a result, your blood pressure starts to come down. So there's a lot of different things that happen as a benefit of these medications. Now, the biggest issue with these medications is availability and cost. Everyone wants to get on them. So it's hard for the manufacturer to actually keep up with it. And unfortunately, the cost of it. It costs anywhere from $1,200 to $1,500 per month to get these GLP-1s if your insurance doesn't cover it. And right now, insurance companies are not covering it specifically for weight loss. They're covering it for the other issues, so for specifically diabetes, which leaves a lot of people without access to a medication that could be very helpful. Teresa's asking about the sleep issues. There are no specific sleep issues associated with the GLP-1s. Now, again, medication is not the only thing that we should be talking about. We should always be talking about exercise. So a minimum of 30 days of moderate exercise a day to help augment your weight loss. Obviously, your diet's very important. If you keep eating garbage, no matter how much weight we're losing, you're gonna end up getting it back. The nice part about this medication though is by decreasing your appetite and by staying on this medication for months, it actually helps to shrink your stomach. So instead of getting a gastric bypass, gastric surgery done, it naturally shrinks your stomach because you're taking in less food. And by taking in less food, over time your body's going to get used to taking in a smaller amount. And even when you come off these medications, there's always a little bit of a rebound back because now you're not having that increased weight loss, but you have that decreased appetite. So your weight loss should stay consistent. So the question is, how can we help with Drip IV? So I'll give you a couple of stories. One, we're actually sending out right now a success story from one of our clients. He was on phentermine. He said his weight was about 275, which was his most unhealthy weight he's ever been at. By being on phentermine for 3 months, prior to it, he was trying to work out, exercise daily, eating poorly, he said. By being on the phentermine helped with controlling his cravings. It helped with increasing his ability to diet. And he reported that he lost and by losing all that weight, first of all, he looks great. We're going to post the pictures and send the pictures on our emails. But by losing that weight, he helped control his high blood pressure, he overall feels better, and all in 6 months, which is absolutely fantastic. Now, we don't want people to lose weight very quickly, because then we get that extra skin. It's not healthy to lose too much weight too fast, but he did it in an appropriate way. He was exercising, he was eating right, he was doing our IV hydrations, he was doing our fat blaster injections. So these are all different ways that he augmented the phentermine he was taking and helped to come off the weight. Now, I'll give my own personal story. I'm on the GLP-1 agonist myself. I was at my heaviest weight about 6 months ago. In 6 months, I have lost approximately 35-40 pounds. And by losing all that weight, my white coat fits me again, which is really nice. Clothes fit better, you feel better, you're breathing better, blood pressure improves. So it's incredible how well you feel when that weight's not on you. So let's talk about how we can do that with Drip IV. So through Drip IV, we have our weight loss programs. The weight loss program is a 3-month program, and then obviously you can keep extending it. The minimum of 3 months is so you can start making lifestyle changes. And what we do with these 3 months is it's all telemedicine. So from home, you get to talk to a provider on the phone, just like you're talking to me right now. And we go over your medical history, we go over allergies, risk factors, we determine which medications are best for you. and then we go forward with those medications. We also added a nutritionist, so she's going to help augment your specific diet, give you a plan of how you should eat, the things that are good for you, the things that are bad for you. And this way, we're hitting you from a diet side and a medication side. Some of the medications that we provide, obviously we can prescribe any of these medications we were just talking about, the Wegovy, the Ozempic, the Mounjaro, if your insurance would cover it based on risk factors. And again, this is difficult. This is why most people are unable to get these medications. We also offer what's called GLP-1 agonists that are compounded. Compounded medications are medications that are made in a specific FDA-regulated pharmacy. These FDA-regulated pharmacies have to follow very strict guidelines. They are able to compound the medication semaglutide or tirzepatide. These are the active ingredients in Wegovy, Ozempic, Mounjaro. These types of compounded medications can only occur because there's an FDA shortlist that these medications are on, because they're in such demand and there's such little of it to go around. So compounding pharmacies out there are compounding these medications at a fraction of the cost of what the brand names are, and they're able to give it to patients directly, shipping it to their homes. So people can get these medications where it would have cost $1,500 a month to $200 a month. These programs are also associated with having to come into the office, checking in once a month, seeing what your weight loss is at, and that way we can monitor you and make sure you're doing well. Other medications that we can prescribe, phentermine. Phentermine is a controlled substance, so having to make sure that you're taking the medication appropriately. It is, again, a 3-month program, and then we take that 1 month off to let your body stabilize. We help to augment weight loss in other options as well. So besides medications and nutrition, we have more natural ways of doing weight loss as well. So we offer 2 main things. One is called Fat Blaster. The Fat Blaster is a combo of B12 with lipoproteins. Lipoproteins are more B vitamins. Combining B12, which builds up red blood cells, gets more oxygen to the body, gives people more energy, with these other B vitamins, people tend to lose about 1 to 2 pounds a week by doing these injections. These injections are done in the office, so you come in once a week, don't even have to have an appointment, walk into any of the locations, and we do those injections. B12 is a very safe, natural vitamin. The only associated concerns with B12, obviously it's a needle, so you might have a little bit of bleeding, a little bit of bruising, but too much B12 can lead to acne. So the bacteria that causes acne uses B12 to actually reproduce. Now, B12 otherwise is very safe. When we take B12 by mouth, so taking vitamins at home, B12 goes in and out of your system within 24 hours. That's why we have daily vitamins. When we do these B12 injections, it can last anywhere from a week to a month in your system. So that's why we like doing the injection form, because it stays in you longer. And obviously you don't have to take a pill every day. So people tend to lose about 1 to 2 pounds a week by doing our Fat Blaster injections. When you combine that with, let's say, a GLP-1 agonist, where you can lose about 20% of your body weight, you're talking about a significant amount of weight loss in the combination. Now, the GLP-1 agonist that we use actually has what's called L-carnitine in it. So L-carnitine is another vitamin, mineral, that's used for weight loss, for energy levels. A lot of people who are working out take carnitine. By doing the injection form, again, it helps to augment that weight loss. And then we have what's called our lean drip. So the lean drip is an IV hydration formula. So the IV hydration, it helps to increase metabolism of fat through your liver. So it helps you actually to break down fat and helps you digest fat faster. With the lean drips, we suggest doing it either once a week or once a month, depending on how much you're looking to benefit from it. And obviously it's got some fluids in it, so people who are working out, it makes them feel better faster. Now, these GLP-1 agonists that we use, these are not brand name medications. So we do not offer the Wegovy, Ozempic, Mounjaro in office. Those are prescriptions that we can write for you though. So as long as your pharmacy carries it, and as long as your insurance company covers it, we can write for those prescriptions, but it is very difficult to get. And then finally, we have more aesthetic ways of doing weight loss. So we have what's called cryotherapy. So cryotherapy is using a wand that has cold waves in it, targeting specific fat areas. So around the neck, around the face, abdomen, chest, wherever. And these cold waves cause what's called cryolipolysis, which means cold-related death of fat cells. So by targeting the fat, killing the fat, it makes the fat go away. So this is one of our most popular treatments that we do. We also do body sculpting, so using body cavitation, ultrasonic cavitation, radio frequency, we can target fat and help to shape the body. We have a lot of great before and afters. We have a couple of our EMTs that actually specialize in the body contouring in each one of our offices. So you can talk to them and see how great these results are. Then we have what's called our InMode Evolve. So the InMode is a specific machine that we have just in Jacksonville. This one helps to tighten, to tone, and to trim, which means it builds muscles, it gets rid of fat, and it helps to tighten the skin. And by doing these three, we have had some amazing results where you can see people building abs, because it literally feels like you're doing thousands of crunches without actually doing the crunches themselves. It's great for women who've been pregnant, who have weak rectus muscles in the middle. It actually helps to form those muscles, and it builds back the muscles themselves. So a lot of benefits associated with the InMode Evolve. And then we have what's called Kybella. So Kybella is actually an injection form that we use. It targets the double chin. So Kybella is injected into the fat of your chin. It causes the fat to actually blow up. So initially it does cause some bruising, does cause some pain. It expands, and then over the next week's time, your fat dissolves and you get rid of that double chin. So for people who are having a lot of difficulty with that double chin area, we have cryotherapy or we have Kybella. And then there's other ways of contouring your face as well. We have a specific type of filler from Allergan that you can use for your jawline to help build back the jawline itself to make it more defined, so it doesn't look like visually, there's an increase in difference between obviously the jawline and your neckline. So quite a few different ways that we can do weight loss. Again, from medications, from natural vitamins, to aesthetics, to actual body sculpting. And all of these you can talk to with our staff. You can go on their website, www.tripivspa.com. You can call the main office line, which is 877-374-7487, extension 2, to talk to our weight loss specialists and get an idea of which one is right for you. If your insurance is not covering these medications, they can be very expensive. So the brand name ones can be about $1,500 a month. By using compounded medications, GLP-1 agonists, the price can be as low as $150 to $200 a month, which is significantly more reasonable. Now, It's, again, not the cheapest medications out there, but they are effective. So unfortunately, you know, that is the price that the pharmacies are charging us. We'll set up that weight loss plan for you. She'll go over your diet. She'll talk to you about different ways of losing weight. Now, we are also starting to do functional medicine as well. So functional medicine is looking at your health before you get ill. So it's a preventative way of doing healthcare, which is better. Obviously, after you've gotten sick, after you get a chronic medical condition, you're stuck with that for life. By preventing that, or by helping to decrease whatever is causing those chronic conditions, we can help with making you better, feeling healthier, and living better. And the GLP-1 is now the most popular type of weight loss. Even Oprah just came out saying she lost a ridiculous amount of weight on it. And you're going to hear more and more celebrities talking about how they're losing weight on this. I would suggest the GLP-1 if you're looking for that weight loss, because it works so effectively. And since we do a step-up process, we limit those side effects. It's very easy to handle, to take. Now, the one thing that we do talk about with GLP-1 medications, if you have a history of suicidal ideation, suicide attempts, this is not the medication for you. It has been known to increase suicidal ideations in those who have had it in the past. It would require a psychiatric evaluation from your psychiatrist before we would clear you to actually take this medication. But if it's just mood swings, mood changes, phentermine unfortunately can definitely cause that. GLP-1s are a much safer way of doing it. These medications, the GLP-1 agonists, are shipped directly from the pharmacy to your house. So you actually do the injections at home. We teach you how to obviously do it. The needle itself, it's a tiny needle. I myself, obviously I put central lines in people, which is the biggest needle in the world. I can put lines in people all day long. I'm scared of needles myself. But these are tiny needles you don't even feel. You put it into your fat. So again, it's a very easy way of injecting yourself. So it doesn't really cause people any issues. So some people obviously don't like the idea of injecting themselves. You can bring it into the office and we can do it for you. The medications are all prescribed by one of our providers. So these are providers who are obviously credentialed in the state of North Carolina. Do we send outside of North Carolina? No. So our providers are all licensed in North Carolina itself. So we are limiting medications to North Carolina. That takes you straight to our weight loss virtual Vigaro link. And you can book right online. Or again, you can call the office 877-374-7487 or 877-DRIP-IVs. And it would be extension 2, where you can talk to one of our weight loss specialists. They can give you a breakdown of the cost. They can talk to you about different services we provide, again, from medications to vitamins to aesthetics to body sculpting. So lots of different options for everybody. All right, perfect. I appreciate you guys jumping on.